liver disease. If the liver disease then at the stage 5 it becomes cirrhosis. Cirrhosis is the liver becomes too much damaged. When it crosses stage 5, that is called liver cirrhosis. So first stage was liver, stage 1 was fatty liver disease, and then stage 5 is the liver cirrhosis. So from 5th stage, it is not. It is difficult to reverse it. It is not easy, but it is possible in Ayurveda, because in Ayurveda we are not talking about English terminologies. We are speaking in Sanskrit language, right? So in Sanskrit language, things are different. The diseases are explained as in Sanskrit words, Halimak, Pandu, such Kamla, such words and terminologies are given to liver disorders. So this kind of disorders, they are considered as reversible in Ayurveda with difficulty. So its prognosis is I would say in Ayurveda it is possible to reverse it, but it is, again I'm telling you, it's very difficult. The doctor should be qualified, the herbs should be good enough, the combination of herbs should be very well and properly balanced, and the nursing assistant should be very good, the person who is taking care of the patient, and the patient himself should be good. By good I mean he should have faith in Ayurveda, he should follow the instructions properly, he should take the medicines regularly, he should follow the diet properly, because diet also has major important role. Because liver disease patient, they ultimately, whatever is the cause, even if it is non-alcoholic fatty liver disease, even if it is viral hepatitis, or even if it is autoimmune hepatitis, any other cause, or even if it is diabetes, liver failure is a liver failure. So ultimately what happens, the liver the albumin level goes down, because the liver is making albumin in the blood, in the body, and it throws up albumin in the blood. And if the albumin is normal, then the ascites is not there. But when the albumin level goes down, the protein level which is there, if it goes down, then the fluid or the water starts to accumulate in the abdominal cavity, and the whole abdominal cavity swells up. There is too much water in the abdomen, because the liver is not making albumin, that is essential protein. So in modern medical system, doctors, they infuse albumin by intravenous injections, but that is a temporary solution. That is not helping the patient in the long run, and that is also expensive. And the doctors also give diuretics to get rid of the water. That is also another temporary solution to get rid of the accumulated water. But that's okay sometimes. But in Ayurveda, we use natural diuretics, natural ways to reduce the accumulated water. We also use natural mild laxatives, which are removing the excessive toxins from the gut and also removing the accumulated water from the system. And also we give certain herbs which are improving the albumin levels. So that helps to recover the patient from the ascites. And slowly the water accumulation reduces. We can use these herbs like tribulus is there, which is increasing the albumin level. We have Indian echinacea. This is called Kalmeg, the king of bitters. This is a very bitter herb. This helps to recover the liver cells. We have Phalanthus neruri. That is also very helpful to regenerate the hepatocytes or the liver cells. We have Punar Nava. As the name says, Punar. Punar means new. Nava means again. Punar means again. Nava means new. So Punar Nava means new again. So we are using Punar Nava to make the liver new again. Right? So there are certain combinations which I am using in my clinical practice. Diet is also very important in liver disease. To dry up the water, we should not consume too much water. That is the first principle, so that there is no water accumulation. 1 liter or 1.5 liter, that is maximum. Along with the ongoing allopathic treatment, I'm talking about serious liver disease conditions, not first stage conditions. Right now, I'm talking about stage 5, as you asked, liver cirrhosis. Liver cirrhosis is a complete liver failure, right?
Yeah,
And
complete. Which allopathy will not reverse, like,
yes,
because they say the early stage liver cirrhosis also can be cured. They are saying these days,
yeah,
but
I'm talking about when the fibroscan is about 75 kPa. That is the final stage. There is a test called fibroscan. It's just like ultrasound. So in that test, it is checked the elasticity of the liver tissue, or whether it is how much is the fibrosis or how much elasticity is left in the liver. If it is elastic, then the fibroscan shows around 40, 30, 35. But if it is highly fibrotic or highly inelastic, then it shows 75 kPa. So in my videos, you can see many patients from 75 kPa, they came down to 25 kPa, 20 kPa, even down to 12 kPa, 15 kPa. So that is a big miracle. So in modern medical system, it's very difficult to bring it down. And they say, so you go for transplant. So I want to tell all the modern doctors through this channel of yours. I want to tell all the modern doctors that they should try Ayurveda while they are waiting for the transplant. Maybe after 1 year of treatment, the patient doesn't need transplant. So this is happening.
do you do
See?
panchkarma or just with herbs you are able to bring it down?
For now, I'm able to do it without panchkarma. So if I get support of panchkarma, that's even better. The speed
It'll be
goes better, but
faster.
it will be faster. But it's okay even without panchkarma, because panchkarma you have to be inpatient. The patient will have to stay in the hospital for some days, and that's difficult for the patient. I am treating patient using the herbs, using the diet. Herbs have their own role. As I told you, I have a combination called Yakrit Plihantak Churna. I made this formulation to heal my patients, not to sell them. See, I am selling them. All the products are available online. All the products are available with various distributors also. But when I started making these products, my intention was only to use them on my patients, to heal them. And the products slowly they got popular, and the company got bigger, and I had to keep the products everywhere. So that's why they are available in different parts of the world. And my patients, they can get them easily. That's also a good thing for the patients. So this Yakripli Hantak Churna contains Kutki. Kutki is Picroraza kuro, growing in Himalayan region. It's called Pitta Virechana. Pitta means the fire, Virechana means the purgation. So light purgation is always important for the liver cirrhosis patient. Not strong purgation, light laxation or laxative, mild laxation. So that is what I am using. The principle of Ayurveda is Pitta. So it's accumulation of pitta in the body. Pitta is the bilirubin. You can understand there is excess of bilirubin in the blood. The bile pigments, they are increased in case of liver failure. So this kutki is helpful. The Revand chini or the Riyam emodi is another herb. So I'm using that. And in diet also I make some modifications. In diet, what I do, I tell the patient to increase the protein intake. Vegetarian protein like sprouts, they are recommended. Milk products, I don't recommend. I stop milk products completely. Only the plant-based milk like soya cheese, tofu. Tofu I recommend to increase the albumin levels. Other herbs like muesli, I have developed a powder. It's called Nourish Max or Nature Amino. It's not like whey protein powder. Mostly doctors, they recommend some protein powders to liver failure patients. I am recommending the protein powder made from the roots of some plants. The plants are Ashwagandha, Vidania somnifera. The other plant is muesli, Chlorophytum borevillianum. Other plant is Shatavari, Asparagus racemosus. So other plants is Gokshura, Tribulus terrestris. These 4 plants and also soybean powder. That's what I am mixing them together, and I am recommending my patients to take 1 tablespoonful. It's available at my website in the name of Nature Amino Powder. So it's good for the bodybuilders, also those who are exercising, but it helps to improve the protein levels and helps to reduce the ascites level in the abdomen. And other than that, instead of wheat and rice, I ask my patient to add on some millets or some uh, jowar or bajra, foxtail millet, barnyard millet, or kodro millet. Such millets, the patients, they can mix in the wheat, like 25% wheat, and the rest of them is different kind of millets. And even barley can be added 10 to 20%, so that barley is a natural diuretic. So 10% of barley, 25% of wheat, and 25 and 25 foxtail millet and barnyard millet, such millets, and some corn flour can also be added to make it 100%.
Oh, nice. Because my mother actually makes it like that. She mixes a little millets with wheat and barley. She mixes
That's
some
good.
millets.
Yeah, that's very good. That helps in water retention also, and also in weight loss also, without reducing the. This is good for the people are gaining weight because of wheat and rice. So that's this is a good recipe for weight loss also.
Yeah.
Millets, and helps to reduce the sugar levels also. And
Is
those who are
barley better
non-veg,
than wheat?
barley, instead of barley, I would recommend millets. Barley is natural diuretic. Barley water people drink in urinary tract infections. Barley is good for the UTI, urinary tract infections. It's good for kidney stones. So it's cooling. So barley is good for the urinary tract. So that's how we use it. Dry dates are good because dry dates are very good for in proteins, and they also dry up the liquid. Dry figs are also good. Dry figs, they also help to reduce the water. They tend to dry up the water. Sometimes I recommend people who are not vegetarian, they are non-vegetarian. I don't recommend non-vegetarian food, but it's in case of non-vegetarian people, they can have egg whites. So white part of the egg is okay for the non-vegetarian people. And dry uh, flesh of chicken, like roasted chicken or this thing, what do you call that? Fish, grilled fish, only for the non-vegetarian, but it is not required. It is not a necessity. You can reverse the liver disease in a better way with the vegetarian foods also. Certain people are there because I'm dealing with people from different countries, from China, from Japan, from different countries. But still, even without these non-vegetarian foods, the liver disease can be reversed and the protein levels can be raised, as I told you, with the dry dates and the figs and tofu and such and lentils and sprouts. So those are the things which I usually recommend to my patients.
Or lentils, which one?
Moong dal is good. Moong dal or sprouts of moong. Split beans also good. Whole moong is also good. Soya bean is also good. And black gram flour or black grams are also good. Sprouts of black grams or white chickpeas. Sprouted form is also good. Or black gram powder, you can mix it in the wheat powder. So it's a specialized information which I'm giving you. It's very, it's not easy. It's not available. It's experience which I am sharing through your channel. And I have seen good results in my patients.
But on a daily basis, we should stick more to moong dal, or we can like we should stick more to lentils than beans, or like moong dal,
Yeah,
masoor.
Moong dal is very light food, so it's okay. In general, we should eat moong dal and khichdi on and off. So that's good. It's good for
And
health.
some days we can add like other like
Other staple foods, different. I'm not talking about liver failure patient now. If you're asking me about the diet, staple food should always be consumed, because we are people living in different continents, different areas, belonging to different cultures. So every culture has their own staple food. So if you go to South India, they are eating fermented food like idli, dosa, sambar, and all those things. And if you give the same food to a Canadian, he won't like it, may not like it. If you give it to Japanese, he may not like it. And if you eat Japanese, if you give Japanese food to a Punjabi person, Punjabi people won't like it. Punjabi, Punjabi people, they like mustard greens. So mustard green is sarso saag with corn flour chapati. So that if you give corn flour chapati to somebody in Russia, he may not like it. They like more seafood or maybe something fish or something like that.
That's true. Because we
So
as like in India, we usually would eat dal more on a daily basis. Like chickpeas and rajma was more
yeah,
uh
it's okay. We can consume chickpeas and kidney beans. Rajma is kidney beans. So we can consume them. It's not a problem. But
on a
it's
daily
better to
basis, or
soak them.
hmm?
Yes, no problem. No problem on a daily basis. Also soak them, and then boil them and then consume. Small quantity, because our body needs at least 80 grams of protein every day. So it's not harmful. If you consume a lot of it, not only one kind of lentil, then other, you mix it up with other food, high protein food, then it can be bad. Otherwise, in small quantity, it's okay.
Small quantity.
Yeah, small quantity is fine.